Thank you for joining us for our Monday COVID-19 briefing. But before I get started on the report with COVID, I want to share updates regarding a tragedy that struck our state overnight in Bradley and Hamilton counties in southeast Tennessee. Strong storms moved through that area overnight. At least one tornado touched down. There has been loss of life and significant damage in that region. As of right now, we know 2 Tennesseans have lost their lives as a result of the storm, and hundreds of structures are damaged. Search and rescue efforts are continuing. I'll be traveling to the area tomorrow morning to survey damage and meet with local leaders. I spoke today with the National FEMA Director, Pete Gaynor, to ensure that the areas get the support that they need. And we do pledge our full support to the residents of Hamilton and Bradley County who are facing uncertainty and tragedy and loss. We are with you every step of the way. And Maria and I join thousands of Tennesseans who are praying for you in this time of real difficulty in your community. Now to COVID. Today, Tennessee has 5,610 confirmed cases of COVID-19. We've lost 109 Tennesseans to COVID and 1,671 recovered cases. During this briefing, I'll outline the next steps for our Safer at Home order, as well as our efforts to plan for economic recovery. It's encouraging. Tennessee has now had more than 10 days of single-digit percentage case growth. Our aggressive testing of more than 76,195 tests has uncovered an average positivity rate between 6 and 8% consistently. Our hospitalization rate continues to be stable, with 579 hospitalizations to date. We're in close consultation with the Tennessee Medical Association and the Tennessee Hospital Association to ensure that the reality on the ground is just as encouraging as the trend lines that we're seeing. The Unified Command Group is keeping a close watch on the issues of supply and capacity. Our team has moved more than 28 million pieces of personal protective equipment to each of our 95 counties. There are more shipments coming in every day. As of today, there are 5,287 open staffed hospital beds in our state. Our hospital capacity continues to remain in a stable position so that Tennesseans who need care can get that care. Our contingency plans for alternate care sites remains on forward track as we keep plans in place for any potential surge that may occur imminently or in the months ahead. And we thank the Army Corps of Engineers for their flexibility in identifying both short-term and long-term solutions for the work of local leaders to supplement these efforts for alternative facilities. We're not out of the woods yet, and it could be some time, but it is clear that the actions that we've taken at the state, combined with the local level, most importantly with the determination of our citizens and the bravery of our first responders and our healthcare workers on the front lines, those efforts have saved countless lives across Tennessee, and for that we are thankful. However, until a treatment's widely available, we have to remain vigilant to incorporate social distancing and good hygiene in our daily routines, or we have a very serious risk that this disease could come roaring back and erase all the progress that we have made to date. Until a vaccine or a therapy is widely available to Tennesseans, this virus will be a present reality for us to manage and consider whenever we're making decisions. However, it's clear that our economy cannot stay shut down for months on end. So we're left with a clear but complicated task. We have to reimagine how to conduct business in a society so that we can operate our economy safely and confidently while continuing to suppress the spread of COVID-19. We need Tennesseans to go back to work, but we also need everyone to recognize that physical distancing must continue for the foreseeable future. Unemployment claims have been 25 times their normal rate, with more than 250,000 initial claims in the last 3 weeks. In cooperation with guidance from the White House, we'll extend our stay-at-home order through April 30th and plan to begin reopening our economy in May. Until that time, our Unified Command Team will continue to consult with experts, analyze all the available data, and monitor CDC recommendations for the remainder of this month. Beginning in May, we begin a phased reboot of our economy. Between now and then, we'll create industry-specific guidance so that businesses can be fully prepared to operate safely and to protect their employees and their customers. In early March, I started working with industry leaders to understand how businesses would be impacted during this pandemic. We pulled together an advisory council that includes leaders from the Tennessee Chamber, hospitality, transportation, and the grocery industries to ensure that we kept a close watch on the health of our state's economy. While these early efforts have helped us to stay informed, it's time to move to a planning and an implementation phase. I'm formalizing an economic recovery group to be led by Tourism Commissioner Mark Ezell that will work in coordination with legislative leadership, local mayors, healthcare professionals, and representatives of impacted industries. By formalizing an economic recovery specific group, this will ensure that the Unified Command Group will continue their focused effort on disease management, improving hospital and testing capacity, and increasing our PPE supply chain. Unified Command Group will also be making recommendations to me about exactly when and how to begin our phased-in reopening of our economy. Defeating this disease once and for all requires specific advances, scientific advances, that are many months away. But until that time, we have to find new ways of living our lives and operating our businesses that will allow us to function as safely as possible while balancing a number of goals that sometimes may be in conflict. Our economy cannot operate normally until these advances are made, and yet an open-ended economic shutdown is unsustainable for Tennessee families. The middle ground will create some discomfort, but more than ever, Tennesseans must come together to keep each other safe by taking concrete actions and establishing new routines. The bottom line is that staying at least 6 feet away from other people makes it very hard for this disease to be transmitted. We have to continue social distancing in public, even as certain restrictions are relaxed. We also want to strongly encourage the simple things: wearing cloth masks in public, touch as few common surfaces as you can, wash your hands frequently throughout the day. Most importantly, stay home if you're sick or symptomatic, and get tested if you believe you have COVID symptoms or have been exposed to any who have. These precautions are for everyone, and the elderly or those with underlying conditions will need to take even further precautions. More details regarding our new normal will be released in the coming days, but I implore Tennesseans to stay consistent in your efforts to flatten the curve. Our ability to successfully relaunch our economy requires every Tennessean to step up and adopt new habits. Before we take questions, I want to have a couple of additional reports to you. First, from Melissa Hucks from our department, from our TEMA agency, to give a report on PPG. Melissa?
Yes, sir. Thank you, Governor. Good afternoon. So on April 12th, the storm system moved through the state of Tennessee, bringing tornadic activity, heavy rains, hail, and powerful winds throughout the state. Our hearts and prayers are with the Tennesseans and with our neighbors who have lost loved ones during these hours. I will report that the State Emergency Operations Center is still activated and will remain activated to support these activities. We had reported tornadoes traveled through Hamilton, Marion, and Bradley County. These tornadoes left a wide path of destruction with multiple injuries. As the governor reported, there are 2 confirmed fatalities at this time. Dozens of homes, businesses were damaged with ongoing damage assessments. We will be working with FEMA to review the widespread damage over the next 24 hours. There is also power outages. Currently, there's 58,000 customers without powers. We are also working with Red Cross for shelters in these areas. If you need assistance, please reach out to them. There are secured hotels that can assist those families in need. One of the messages we want to make sure that we pass along is if you are out, please avoid power outages and lines across the way. Please ensure that you're allowing emergency personnel to clear the roads properly for access, and do not enter damaged building or hazardous locations.
Thank you, Melissa. Again, as I said, I'll be traveling to the area in the morning to meet with local leaders there and to continue to provide support to those in Hamilton and Bradley County and beyond as they face this unique tragedy that has struck in the middle of ongoing difficulties. So we thank TEMA for their efforts and FEMA for their continued work with us, and we will pledge our support to all of you. Dr. Piercy, would you come up and give a health report, please?
Thank you, Governor. Good afternoon. As the Governor mentioned, our case count is 5,610. I do want to make note that this is the 10th consecutive day with a single-digit percentage increase. That's really good. That means our curve is flattening. And so we want people to continue their efforts and be mindful of how we can do that as we start to reopen the economy, as the Governor mentioned. I also want to make note that we have now done over 76,000 tests. That is a lot of tests, particularly when you compare it to the states around us. You may be tempted to look at other states and say, oh, their numbers are a lot lower or their deaths are a lot lower. I would also encourage you to look at the number of tests that these other states are doing when comparing apples to apples, because we know the more you test, the more you will find. And the more you find, the more you can contain and mitigate. So I want to talk a little bit about what happened on Friday. You'll notice that from yesterday to today, we have had over 5,000 tests added. About 20% of those were tests that were done by our National Guard partners in 2 different prison facilities on Friday. 1,145 staff members at Bledsoe Correctional and Northwest Correctional were tested on Friday through our National Guard partnership. Of those, 19 staff members tested positive, 9 at Northwest and 10 at Bledsoe. That's a combination of both TDOC, Tennessee Department of Corrections staff, and contract staff in those facilities. The interesting part of that is that many of those cases were asymptomatic, which means they didn't look sick and they didn't appear sick. And so that really highlights the importance of social distancing as well as proper hygiene and personal protective equipment. Finally, I want to reiterate what the Governor said about our partnerships with our provider organizations, specifically Tennessee Medical Association and Tennessee Hospital Association. These partners are giving us a continuous, accurate look at what their on-the-ground capacity is. Models are important, projections are important, but on-the-ground capabilities are what's most important. We're confident in our position, and we really appreciate the partnership that they provide us. I'll stand by for any questions you may have.
Thank you, Dr. Piercy. And to just reiterate the point that she made, many are asymptomatic carriers, which is why it is so important that we continue our efforts to increase testing across the state, and we will be doing so, as we have been in the past weeks, we'll be doing so even more aggressively in the weeks ahead. So let's open up the lines for questions. We have members from TEMA, Unified Command Group, Department of Health, to answer questions that you might have.
Thank you, Governor. First, we'll go to Andy Scher with the Times Free Press. Andy, your line is open.
Thank you. Hi, Governor. So I guess for starters, you were dealing with one crisis, and now you're dealing with 2. How does that work? And I mean, do you place priority for one over another, or do you do this simultaneously? And how difficult is that for you in the state?
Well, we certainly have a challenge in our state. We've had the original tornado that was devastating, that we are still providing support for those residents as well. And the COVID efforts that we have, and now this tornado and storms in Hamilton and Bradley, we have a strong response to that crisis in Hamilton and Bradley. Our teams are on the ground now. There's search and efforts being made. Local officials in combination with the state officials, in combination with federal officials. We know how to respond to a tragedy like that, and we are in the midst of that response. It doesn't change or lessen our approach to the other challenges that we have across the state. So, as I said earlier, we have a pledge of full support to this crisis that falls on top of the other crisis we have in our state. But we feel confident that the response is as it should be there, and we'll have a lot more. We'll know a lot more about it as the day unfolds, and particularly tomorrow. But I'm very proud of the immediate response of local officials there in those counties, and our efforts as well as FEMA.
Thank you.
Yes, sir.
Next, we'll go to Jordan with WTVC in Chattanooga. Jordan, your line is open.
Hey, Governor. Thank you for taking questions. I have a question. It's about, I don't know if you can answer this for me, but it's about the status of surge hospitals. You just said that they're on track, they're moving forward. But in Chattanooga, we spoke to the Austin plant manager, and he said that it's been put on hold because of the status, not sure when the surge will hit. Can you explain that more, please?
Is your question, I'm sorry, is a little bit of background noise. Are you asking about the surge?
Yeah, surge hospitals. We spoke to the Austin plant owner here in Chattanooga, and he said it's been put on hold
So
because he's not sure.
You're talking about the alternative sites for capacity for hospitals. I'm going to let Stuart McWhirter, who's the head of our Unified Command Group, talk about our plans to provide alternative sites across the state and to prepare for those when needed. So, Stuart?
Thank you, Governor. First of all, just one thing that Dr. Piercy indicated in her remarks is that we are staying in close contact with THA, who is monitoring the bed capacity in all facilities around the state. And just so you all know, there are 12,000 staffed beds in Tennessee. About 5,700 of those beds are occupied, so about half are being occupied at the moment. They all have a surge capacity of about just over 17,000 beds within their own facilities. So we have plenty of capacity as it stands today. And on ICU beds, we have just over 2,000 beds staffed beds in Tennessee. About 1,200 of those ICU beds are being occupied, and there's about a little over 4,000 bed surge capacity for ICU beds around the state. So again, those hospitals across the state have the ability to take on the additional surge if it happens. But with that said, we stay close contact with the hospitals, and we are working on a contingency plan around the 4 major cities. We've identified potential locations with the partnership with the Army Corps of Engineers. We are still assessing because, as the governor has said and as Dr. Piercy has said, we will likely have some short-term needs potentially, but certainly long-term needs. So we're looking at facilities that we can utilize over a 12-month, 18-month period. We continue to talk to those locations. If anything's on hold, it's only because we continue to assess. But we have gotten down the road with our work with the Army Corps of Engineers to identify the right facilities that we can occupy, not only in the short term, but the long term. So if anything's been put on hold, it's only because we're just continuing to assess, but it doesn't mean that we think that we don't need them. We're just being prudent in our due diligence, and as we get closer to understanding the data and understanding the number of positive cases that convert to hospitalizations in our conversations with the hospitals and the medical community, we'll have a better assessment of that.
Next, we'll go to Kim Crucy with the Associated Press. Kim, your line is open.
Hey, Governor. I wanted to return to your comments about having a number of goals or operating a new way, basically Tennessee's new normal. You had mentioned conflict possibly within those goals. Can you clarify a little bit about that? Do you believe that there is conflict of beginning to reopen the economy with protecting Tennesseans from this virus?
Well, let me just say the safety and the health of Tennesseans is the utmost concern. So we know that when we begin to take a step, whatever that step is, however measured or smart we take a step, we know that that presents the opportunity for an increased number of cases. So that balance there, that understanding that safety and health is most important, but that our economy can't stay shut down for months on end, that creates a balance that we've got to carry appropriately. That's why the decisions that we make will have to be in close coordination with healthcare officials, with capacity of our healthcare system, with the capacity that we have in personal protective equipment to make certain that if there are additional cases as a result of taking a step to open up the economy, that we're prepared to meet that and then to balance those two going forward. It is a challenge, but it is, as we said, it's a clear path forward that we have to take. We know we have a clear path forward to take. The direction and the specific steps in that path are not determined yet, but we'll take them considering that balance.
Is there any data? I mean, I'm curious with the May 1st deadline here, what would have to change your mind, or what would have to happen for that date to move? Or is it May 1st or nothing at this point?
Well, as we've said, a lot of things have to come together in order for that to happen. There are a number of points that come together for that. The continuation of our curve going the right direction, the clear understanding that we have sufficient capacity in our personal protective equipment and hospitalization capacity. We believe strongly that when we take the first step to opening our economy, we should have broader testing all across our state, and we have a continued strategy to do so. So there are a number of things that have to be in place. We believe they will be in place. But we will be monitoring those over the next couple of weeks and defining specifically what that opening up looks like, what that reboot of the economy should look like. There'll be specific steps around that for particular industries, potentially considerations of geography, and those will all be things that our new economic recovery group will help advise in conjunction with our unified command group.
Thank you.
Next, we'll go to Joel Ebert with the Tennessean. Joel, your line is open.
Hey, Governor, thanks for answering questions. I was off for a week, so I've got two questions for you.
Okay.
You originally asked all schools to remain closed until April 24th.
Yeah.
How does this new decision to extend this executive order until the end of the month, how do those, become congruent? Will you ask schools to follow that same action? And then secondly, about testing, you stressed the importance of testing, yet the latest data showed between yesterday and today there were just 2 tests done by the state's facilities. Can you explain that?
Well, we actually had about 5,000 tests, if I'm not mistaken, done in the last day. 2 of those in the state lab. We reserved the state lab. I'll let Dr. Piercy specifically address why those might occur within the state lab or through private testing facilities. But the most important number for us is the number of tests. As the testing turnaround has improved, where those tests occur are not nearly as important as they once were. But I'll let Dr. Piercy talk about specifically the test dates. With regard to schools, we're going to be making a decision, and we'll have more to say about that on Wednesday. We felt it important to get this decision about this stay-at-home order in place and to put together this economic recovery group so we can begin the planning for opening up our economy. But we'll coordinate that with schools, and we'll have more to say about that on Wednesday. You want to say something about the state lab?
The governor's right. We reserve the state lab capacity for emergency or high priority cases. We did have 2 of those yesterday and got those processed very quickly. As you may remember from last week, we talked about some of our quick turnaround, the 45-minute and the 5-minute test are both available in the lab. And when we have high priority needs, we use those platforms. The good news is that we have private lab capacity in Tennessee. And you may have heard me mention before, every Monday morning I start the week by talking to my counterparts in the Southeast. And this morning on the call, we talked a lot about testing. And quite frankly, we're ahead of all of those folks on the call, maybe with the exception of Louisiana, and they've had an extraordinary circumstance down there. The private lab capacity is not nearly as robust in other states as it is in ours, and so we're happy to use our private lab capacity. Was actually on the phone today with another lab that's coming online this week, so we're really blessed here in the state to be able to plan our reopening efforts because we have such good private lab testing capacity.
Dr. Piercy, just one quick question. You alluded to there being the state reserving testing for high priority. What does that mean? Who becomes a high priority?
Sure, that's a good question. When you have healthcare workers or nursing home or vulnerable populations, we've talked about prison testing, we have plenty of capacity in the state lab, but as long as our private partners are having good throughput, we reserve our capacity for those high priority tests that I just mentioned. We have plenty of capacity and do that on a normal day. I will remind you that yesterday was a holiday, so we got less tests in, but I expect us to be at full capacity again today.
Thank you.
Next, we'll go to Phil Williams with News Channel 5. Phil, your line is open.
Good afternoon, Governor. My questions are about nursing home residents and other facilities for the elderly. Do we know exactly how many residents are affected in these statewide facilities?
I'm going to let Dr. Piercy answer that.
Our contact tracing folks and epidemiologists do know exactly what is in each facility. We do not report that publicly, but please be reassured that we know exactly what's going on in each of these facilities. I'll remind you that we did publish a list on Friday. I believe there were 10 on that list, and we'll update that again on this Friday.
But that list, Commissioner, only includes facilities that have two or more, as I recall. So families don't know whether it's 2 cases or 200 cases. Why can the state not be more transparent about just how bad the scope of the problem is?
Yeah, so you're right. We just list the name of the facility. We do not publish the number of cases, but please be reassured that those numbers are going out, and that notification is going out per facility. And so we're just posting those facility names for the public's benefit. And we took our cues from many other states that are doing the same, most of whom are just listing the name of the facility and the location.
Can you tell me why you could not be more transparent and give the exact number of cases?
That's something that's in that data field that we've been talking about over the last few weeks. This is all a new data process for us. And while we just started collecting that information, it may be in the future that we can release that if it is not a re-identification risk. Many of these facilities have a very small number, and it's in staff and or residents, not just necessarily residents. And so if that becomes a need that we have later down the road, we're open to considering that.
Next, we'll go to Alex Apple with Fox 17. Alex, your line is open.
Governor, because this is so unprecedented, nobody has any idea. No Tennessean probably has any idea what a phased reboot of an economy looks like. So is there anything, and I know you don't know exactly how it's going to shake out yet, but is there anything you can say to give Tennesseans and us an idea of what that looks like? Is it certain people can go out, certain businesses open, and then others don't? And my question on top of that would just be, I'm guessing that you would say that this is entirely your decision and other governors. The president says that should be entirely left up to him.
So you offered a couple of options. There are a number of options that might be a part of and might be the first step to a reboot. And that's exactly what the Economic Recovery Group is intended to do. It's to work with the healthcare officials to understand from their perspective what's most important with regard to capacity and healthcare facilities across the state that are struggling, in fact, because of the low number of activity, the low amount of activity in their facilities. It is going to be met and determined in conjunction with industry groups. We know that certain industries have particular challenges when we decide to allow them to go back and open their businesses back up. So we'll be working with those individual groups. It has to be done in conjunction with the citizens of the state too, and the restrictions that have been placed on Tennesseans and the way that Tennesseans have stepped up. All of those are among a long list of options that'll be considered to develop the plan over the next couple of weeks for this rebooting. And with regard to the federal government, I was on a phone call with the White House today. Vice President Pence is working with governors from, well, every governor in the country, actually, to develop specific strategies for everything COVID-related. We have a great working relationship with the federal government, and we feel certain we can do this in conjunction with whatever their guidance is.
And one quick follow-up, just the expanded testing that you mentioned a couple of minutes ago about that needing to be an important part of the reboot. Are you meaning antibody testing, or are you meaning simply being able to test potentially infected patients?
Yeah, that's a good question. And I think both of those is true. They will come online in different times. We currently have the ability to test for those who carry the virus, and those efforts have been strong in our state, but we've got to make them even stronger. And Dr. Pierce, you want to make a comment about antivirus?
Yeah, so antibody testing is a hot topic these days. And we have only had, or the United States has only had one approved antibody test that was just approved early last week. It's the CellX platform. That one is not yet on the market. We expect perhaps to have the first test in hand maybe by the end of this month or the beginning of May. But I just do want to warn people that the antibody tests on the market right now that are in production are not FDA approved and are not considered to be reliable. However, we are really excited about the prospect of antibody testing coming online in the next 30 days or so, because we believe that we'll be able to tell us about past infection. The swabs that we do right now tell us about current infection, but once you're over that infectious period, it can't tell us if you've been infected and you're perhaps immune. So wider antibody testing that will be able to tell us who is immune, at least for some period of time, will be an integral part of reopening our economy.
Next, we'll go to Nancy Amons with WSMV. Nancy, your line is open.
Thank you for taking my call. Governor Lee, the Vanderbilt study talked about lifting social distancing scenario overwhelms hospital capacity if done prematurely and without widespread testing and contact tracing in place. Are you prepared to open testing to anyone who wants a test, symptomatic or not? And did you talk about your decision with Dr. John Graves at Vanderbilt?
You know, we are, we look at a lot of models that have a lot of, those models have a lot of variables in place, so we're not intending at all to lift social distancing efforts. We know that we may change requirements or restrictions, but social distancing is going to be a way of life for Tennesseans going forward. Until this virus has a vaccine, and that is a long time coming, months, maybe a year and a half, until we have a vaccine, social distancing is a way of life because the virus will be present. So we've got to incorporate social distancing into any efforts we make at opening the economy back up, as it were, or rebooting the economy, taking steps that will allow people to go back to work, which is an important part of the future for us. We will incorporate that social distancing in whatever strategy we bring forth in the next couple of weeks.
And did you talk to Dr. John Graves at all about your decision?
I did not talk personally with Dr. Graves, no.
Thank you.
I will say, though, that we spoke with healthcare officials from around the state, including the Tennessee Medical Association, the Tennessee Hospital Association, CEOs from several large hospitals across the state. So we have, we understand that this decision and this reboot and the steps that we're going to take have to be made with the consideration that the safety and health of Tennesseans is utmost. We can't sacrifice the safety and health of Tennesseans, but we also can't keep our economy shut down. So that's why we're bringing healthcare officials and making certain, we've had them in the process all along, but making sure that they are a part of this next phase of developing the strategy of a planned reboot.
And the other part of my question, I'm sorry, will you open testing to anyone who's asymptomatic?
Well, I'll let Dr. Piercy talk about that. We certainly want to expand testing. If we said today, everyone in Tennessee go out and get a test, we don't have the capacity to do that. But our capacity is increasing rapidly. So we will be expanding the numbers of people that will get testing, and I'll let you make a comment about that.
Yeah, that's a good question because we've been working on that over the last few days and intend to finalize and publish our plan by midweek for expanded testing. As the governor mentioned, we don't have the ability to test every single Tennessean at this time, and it's important to realize why that's not helpful anyway. As with any infectious disease, you can be negative today, but you could be positive by the end of the week, either because you were exposed before it was too soon for it to show up, or because you were exposed in that time period. So just the fact of getting that diagnostic, what we call PCR or swab test today, only means you're negative today. However, we have a lot of ability to expand the people that we're testing. So we're quickly getting to a point that if you think you need a test, you can get a test. That doesn't mean we can test everybody, but if you have any inkling of a doubt that you need to be tested, then we're going to be able to do that. We look forward to sharing details of that expanded testing plan later this week.
Thank you.
Next, we'll go to Chris Bungard with WKRN. Chris, your line is open.
Thank you, Governor, for taking my question. And my question is about the specific businesses you're looking at for opening up the economy.
Yeah, that'll be a part of the decision-making, Chris. As I said earlier, there are a lot of options to this planned step, first step, second step, third step. It will be smart, it'll be safe, it'll be measured, but we do not have a definitive decision on what those steps will be yet. That is what our economic recovery group will be determining over the next couple of weeks. There are a number of businesses that are open in our state. One of the things that we're going to be doing is providing guidance for those essential businesses and their new operating procedures going forward. We need businesses, both the essential ones that are currently operating now, to begin thinking about how it is that they operate in the future environment of more activity with the presence of the virus still in our society. So we'll be providing guidance for those essential businesses, and then we'll be making determinations about how those non-essential businesses will come back online, in what ways, in what areas, and what the guidance is for those businesses as well. So we don't have the specifics yet. That's exactly what this plan development will be, and we'll be announcing some of those particulars about the plan over the coming 2 weeks.
Well, but is it something like restaurants, bars, the tourism industry that you're looking at specifically here? I mean, that's where an awful lot of the unemployment figures are coming from in this state.
Yeah, I think that we will have to look at every option. We will look at every business that's currently closed and consider the role that that particular type of business plays. That's the reason we're including industry groups in our economic recovery group. Those who represent those individual industries can give guidance on when, how, and what changes have to be made in order for a specific type of business to open. Those are all very important if we're going to start our economy moving again or moving forward in a greater way, and at the same time provide for safety for all Tennesseans. It'll be a new way of doing business, and we'll be discussing that with those individual industry groups over the next few weeks.
Thank you, Governor.
Yes, sir.
That's all the time we have for questions today, Governor, if you would like to make a closing statement.
Yeah, again, thank you for joining us and allowing us to give more information. We want to do this as frequently as we possibly can. I want to close my remarks again in the same way that I opened them, with our hearts and our efforts and our work being focused not only on COVID, but in particular today, tomorrow, and in the days ahead for those residents of Hamilton and Bradley counties that have been hit with a tragedy overnight. Our hearts go out to them, our prayers go out to them. Importantly, our efforts on the ground with local officials, with first responders, again, with healthcare workers who are responding to the injured in this. And our hearts and prayers especially go out to the families who have lost loved ones there. We know that the recovery efforts are still taking place, and so we're aware of the incredibly difficult circumstance down there, and we want you to know that we are with you. Thanks again for joining us for today's briefing update.